Welcome to our series on being pregnant in a pandemic, a guide to pregnancy care for low-risk pregnancies. My name is Dr. Elyse Lackie, and I'm an obstetrician and gynecologist. In this video number 2 of 7, we're going to talk about the beginning of the second trimester, 12 to 16 weeks. We'd like you to click on the link to fill out our anonymous survey that we will use to research the impact of our education. It's important to do this before you watch the video. There'll be another opportunity when you're done. So, your first appointment, possibly in person or virtually, with your obstetrical care provider. What can you expect? We do recommend one in-person visit earlier in your first trimester, but this might be with your primary care provider. At this first visit with your obstetrical care provider, we're going to focus on a few things, specifically risk assessment, physical exam, and different tests that we can do to look at the health of you and your baby. The risk assessment is really important. This is where we talk to you about your health and past history and figure out if there's things that we should be a little more concerned about for you or your particular pregnancy that might guide us in terms of doing more tests than you would otherwise normally get. This might involve a history of previous blood pressure, as an example. The physical exam is an important piece, and we will gather information about your weight and your blood pressure, as well as your baby's heart rate. And lastly, we're going to look at the blood work that's already been done by your primary care physician and figure out what other tests might need to be required. This is also a really important time to talk about screening tests that you might have already completed or what could be available to you at this time. We'll lastly arrange for you to organize your second trimester ultrasound, which is where we look at the health of the baby through anatomy, and it's usually done around 18 to 20 weeks. Now, I mentioned screening a little while ago, and that's an important word to understand because the screening test helps us figure out if you or your baby might be at risk for certain problems, but doesn't actually tell us if you are at risk. Specifically in pregnancy, we talk a lot about the risk of chromosomal problems, and there's a variety of tests that we can do to look to see if your baby might be at risk for certain chromosome problems. Many of these tests are done by around 12 weeks gestation, but can be done a little bit later on as well. So your obstetrical care provider will talk to you about those options to see what might be right for you. Now that you're into the second trimester, we need to think a little bit more about nutrition. In the first trimester, you really don't need a whole lot more in terms of caloric intake, but starting in the second trimester, you do need a little bit more. The good news is no specific diet is required, and really a good rule of thumb is everything in moderation. If you follow Canada's food guide, you should be doing really well. Importantly, for women with normal body weight, as I mentioned, you don't need to add a ton of calories to your intake, but a little bit is important. It's also important to make sure you're taking your prenatal vitamins, including folic acid and iron, and you do try and limit your caffeine intake. Lastly, we do recommend that you try and avoid foods that are high in mercury, such as large fish like tuna, and try and avoid undercooked foods as they do carry a higher risk of infection that might impact you or your baby. Fortunately, there's lots of great resources out there to help guide you in your dietary intake during pregnancy. And as I mentioned before, everything in moderation is a good approach. A lot of people ask us questions about how much weight they should gain. And in general, through a whole pregnancy for a normal weight woman, you should be gaining just under a pound a week on average. On the slide, you can see some examples of how much weight gain overall for the whole pregnancy you should be aiming for depending on your baseline weight. Exercise is actually really important in pregnancy. A lot of women think they should really cut back, and that's not necessarily true. We do encourage exercise as it will help you keep your weight at a normal pace. It'll help you sleep better. It'll keep you in better shape for delivery and recovery afterwards. Things like walking and yoga can be great, as well as prenatal exercise classes, and also swimming can be a fabulous exercise in pregnancy as you feel weightless when you're in the water. We encourage you to aim for 20 to 30 minutes of pretty rigorous activity 5 or 6 times a week. There aren't very specific things that you should avoid, but we do recommend you avoid things that have a higher risk of causing injury, such as high speed activities like skiing. Also, as you get bigger, your balance is going to change as your baby grows. And so it might be prudent to avoid exercises that really do require a lot of balance to limit your risk of falling. And abdominal workouts are okay as long as you're really doing a proper pelvic tilt and maintaining good core contraction. You should talk to your healthcare provider about the vaccines that you might need during pregnancy, where to get them and when to get them. Another thing people ask about a lot at this stage is sleep, and you'll hear all kinds of things about how you should or shouldn't sleep during pregnancy. The bottom line is you can sleep any way that feels comfortable for you. If you are lying down and you feel well, you don't feel lightheaded or dizzy, that position should be fine. Women do find that placing a pillow between their legs or under their hips can make them more comfortable. And importantly, you want to practice good sleep hygiene, which means doing things that help you sleep better through the night, such as not drinking too much fluid before you go to bed so that you don't have to get up and pee. And also to limit your exposure to things that really get your mind going before you go to bed, such as TV with lots of action. Sex during pregnancy is absolutely fine for most women. Women have been doing it for thousands of years, as long as you're feeling comfortable. There are some situations where we would recommend avoiding sex in pregnancy, and your obstetrical care provider will point that out if this is relevant for you. What about COVID-19 in pregnancy? COVID-19 is certainly bringing anxiety to all of us because of the uncertainty, and this is absolutely true for you as a pregnant woman for all the usual reasons and possibly extra stressors, such as the financial concerns and worries about how to manage through your pregnancy and with the new baby at home in these uncertain times. We do find that women might experience some increased anxiety during pregnancy, and there are lots of great resources to help you through this. A couple of them are listed here on this slide. When should you go to the emergency room? During COVID, we do recommend that you try and limit non-urgent appointments as much as possible, but there are certainly times where you should seek emergency care, and this is true during pregnancy as well. In general, we recommend if there's significant bleeding and significant pain or cramping, you should go be assessed in an emergency situation. But also if you are leaking a reasonable amount of fluid or have a specifically increased and significant abnormal discharge, this should be looked at as well. If your symptoms are mild, you might try and reach your obstetrical care provider first, as this might be able to be managed with an over-the-phone or in-person appointment through the office. Now, frequently asked question. These days, this might be the most commonly asked question, and that is, does pregnancy increase my chance of getting COVID-19? Well, certainly what I'm about to say might change as we learn more and more, and we don't have all the answers. But as far as we're aware so far from the studies done, the good news is that pregnant women do not appear more likely to get the infection compared to the general population. They also do not seem to get more sick than the average person, and as far as we can tell, babies do not get it during pregnancy and during delivery as well. Now that we've made it through this video, we'd ask you to once again click on the link to fill out our anonymous survey, and we can use this to research the impact of our educational videos to help you better in the future. Congratulations, and thanks for watching this video with me. You can now continue on to watch our next video to see what's coming up next in the course of your pregnancy. Please don't forget to download the handout found in the description box below, and do fill out the feedback form to tell us how we can better assist you. If there are enough questions, we will post a panel Q&A session with some of our talented healthcare providers. Video number 3 is up next, more appointments, how and when from 16 to 20 weeks.